Hello and welcome to our podcast, The Doula and The Doc, hosted by Vanessa Salerno, a birth and postpartum doula.
As well as Dr. Joseph Scroy, an obstetrician, gynecologist and fertility specialist.
Together we'll be discussing a range of topics from preconception, pregnancy, birth and also the postpartum period.
Together we combine holistic insights and medical expertise. We dive into women's and men's health with honest information and sometimes the unexpected conversations.
This podcast is where evidence meets experience, so let's start the conversation. Please note the information provided in this podcast is for educational and entertainment purposes only and is not intended as a substitute for professional medical advice, diagnosis or treatment. Always seek the advice of a qualified healthcare professional regarding your own pregnancy, birth and health-related conditions.
This season of The Doula and The Doc is brought to you by Libra.
Welcome to the Libra Odd Spot.
Yes, if anyone knows when you are in the bathroom and you are taking out your pad, we have odd spots and we love to sit and read while we're in the bathroom.
So stop scrolling and start reading.
Walt Disney was afraid of mice.
Really?
I know, right?
That's weird. He drew a character called Mickey Mouse. Right. A bolt of lightning is powerful enough to toast approximately 100,000 pieces of bread.
This episode we're talking about pregnancy, the good, the bad, the ugly and the unexpected.
Unbelievable.
Unbelievable. That's very good. I think that obviously myself when I'm supporting couples and women, there's a lot of anxiety when it comes through pregnancy. And certain things about what to expect, what not to expect, what is normal, what's not. And there's all the things about like cravings, fatigue, and we talk about morning sickness, and we always think it's the first trimester, right? But it's not really morning sickness. It doesn't always hit in the morning.
Absolutely. And, one of the things, particularly for couples that have been trying to conceive for such a long period of time, there's this, this waiting and expectation for what's eventually going to be. Yeah. And I think part of that is what's going to be in terms of having a kid, because we know what's involved when we see that baby. We get to cuddle the baby. You sort of got an understanding that you're going to have to change nappies, and for women potentially who want to breastfeed, they're going to have to breastfeed. But not much of an understanding of what actually happens during pregnancy.
No, they don't.
Yeah. And if they do, it's all about the scary stuff.
Oh, yeah.
So, I think the first thing is just the wonderment of life. I'm reminded of Tim Minchin's musical, or he wrote the musical for Matilda the musical. Yeah. And he said life is a miracle, and the most common thing in life is life. And yet the miracle of life is so rare that the mere fact that a sperm has met an egg, whether it be in a laboratory or whether it be inside a woman, and that has fertilized, become an embryo, implanted itself into a uterus, is just such a magical and wonderful thing. And we shouldn't lose sight of the fact that each one of us is an absolute miracle.
Yeah.
And I think that's such an important thing to first start off with, because then everything that sort of transpires during pregnancy needs to be put into the light of that miracle of what is life. Yeah. And there are a lot of symptoms, a lot of things that women go through that are very difficult in terms of the first trimester, that blokes don't understand, perhaps their partner doesn't understand, but are just very common and often are debilitating, and we don't even understand really why they occur. Yeah. But that there is a reason for it, and we'll go through some of those things.
And I always think too that for us women, as soon as we see the 2 lines of that positive pregnancy test, it's instant. Men, it takes a while for them to catch up to what's happening until the belly grows, until things are happening, until they see the first scan and go, oh, look at that flicker. There's life in there. Like it takes them a little bit. For us, it's like instant. Yeah. Yeah, like we understand that a little bit, or click onto it very differently.
And every woman's different. So some women, I've known someone who said that as soon as I've transferred the embryo, 2 days later they know they're pregnant. They knew that there was something different from that embryo transfer apart from the other embryo transfers that may have been unsuccessful. But some of the very common pregnancy symptoms, of course, are fatigue, just generally being quite tired. And, we've got to remember that back in if we think of ourselves as animals living in a jungle, before you become pregnant, you're trying to find a mate. So you're running around, who's the best looking bloke out in the world, or who's going to have the most intelligence. I mean, that's what, animals do. They're trying to mate with the best quality mate, right? So, of course, you're heightened to all that sort of stuff. Bang, 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 bang. Then eventually you become pregnant. And what do you want to do? You just want to nurture yourself, put yourself in an environment that's going to protect you, because ultimately protecting you is going to protect your baby. And part of that response is that general fatigue and just feeling overwhelmed with everything. And that is normal.
Yeah, because most people say, I'm never a napper, but I'm nappy.
Correct. And I think the thing about it is we live in a modern society where we've got to continue with our daily routine, and we don't have that opportunity to be able to do what our bodies actually want us to do, which is just relax.
And saying that, it makes sense, because just before they give birth, they become tired again. And knowing that you need to relax, you're about to have a baby, and you do this full circle of because then they get this boost of energy second trimester, and then it goes back to the first trimester.
Correct. And it's also, why do you get insomnia during pregnancy? Is it just because, or is there something that's predestined to sort of get you used to the fact that you're going to be waking up in the middle of the night caring for a baby, and rather than have really good sleeps during pregnancy and all of a sudden deal with a baby that's waking up in the middle of the night, and then you're grumpy and upset because you've not been able to sleep for such a short amount of time, your body gets you habitually ready for that whole process. So there's a lot of stuff that we probably don't truly understand, but actually makes sense in the lens of how we've developed over the millennia.
And the whole thing when it comes to morning sickness, I know that people, when we get calls, that they'll say, it's settled and there's no symptom. I need to see Joe for a reassurance scan, because that was also comforting to know that they were still feeling sick.
Yeah, so some women will get so basically morning sickness, really poorly understood, probably a relation.
It needs to be changed, because it's all day.
It's all day sickness. So just general nausea and hyperemesis, which is the pathological, the bad form of nausea and vomiting, where you're not keeping fluids down, you're vomiting, you're unwell.
Yeah.
It probably has some sort of basis in terms of trying to food avoid. So, if we're animals living out in the jungle and there's a potential for you to eat something as a woman that's going to put your body at risk and potentially the pregnancy at risk, the body's going to try to avoid those foods and make you feel generally unwell and sick, so you're not eating and protecting yourself. So it does make sense. It's just when it goes over the top, and this is probably related to genes, high estrogen levels, high HCGs, other hormones that are affecting why women have hyperemesis or the like. But it's important to know it's common. It's also important to know that it can have an impact on your mental health. So you just feeling like you're not keeping fluids down, you're fatigued, you run down, that's all normal. And again, it's about exploring the village that's going to be able to support you. So that may include a dietitian, it may include a psychologist, your obstetrician, your midwife, the hospital system. Fluids, having IV fluids may be particularly important. And then you can use very simple things like vitamin B6, ginger. Some people love just the having a lemon, sucking on a lemon. There's whatever makes you feel good in terms of reducing the symptoms. Acupressure bands, acupuncture. And then we can utilize medication as well. So things like Maxilon, Stemetil, Zofran. And if I
find that people are like, I'll do that as they're just like, I won't take it. It's my last. But then they have to realize how unwell they can feel.
Well, it's about impact to quality of life. Yeah. So if you're having a major impact quality of life, sure, try all those natural remedies beforehand. But if it's getting to a point where you're really unwell, I mean, I think you need to sort of say, there's medicine for a reason. And look, we know now that the medicine we're giving is safe and it's been tested in terms of pregnancy. I will never prescribe something, and most doctors, of course, if you tell them they're pregnant, will not prescribe things that are going to be unsafe in pregnancy. So you can be reassured that what we're doing is safe. The other thing that's particularly common, of course, is constipation, and that does have a basis and a reasoning for why it occurs. So we talked in previous episodes about progesterone, this pro-pregnancy hormone. And the placenta will predominantly produce a lot of progesterone in throughout pregnancy. And what progesterone does is it actually slows down the transit time of food coming from the mouth effectively, or through the stomach, through the intestines to the outside world. And it makes sense, because what it's trying to do is give every opportunity to absorb as many nutrients from the food as possible. Now, that was great when we lived 300, 400 years ago and we didn't have huge amounts of food, because if you only got one meal a day, you want to extract as many nutrients from that food as possible to support you and your baby. Yeah. But not so good when we live in a developed country where you have 3 meals a day plus more, and everything just gets backlogged. It's like, your toilet just getting fuller and fuller and fuller of toilet paper and you can't flush it. Yeah. And that's where constipation happens. So, very simple things in terms of constipation. Drinking heaps of fluid, making sure you're exercising, a couple of kiwi fruits. Yeah. Kiwi fruits a day. We learnt that from our
physio.
No, we learnt that from.
What did you?
From our pharmacist friend.
Oh, yeah.
Yeah, that's right.
Well, Laura's our physio too. 2 kiwis a day.
2 kiwis a day keeps the poo at bay or something like that.
Yes.
So kiwi fruits are particularly good. And, of course, there are simple things in terms of what you can gain over the counter from a pharmacy in terms of medication to soften the stool. So that's particularly important as well, because constipation, if you're constipated, you're nauseated, you're taking medication that can constipate you even further. Yeah. I mean, it's going to make the whole premise of being pregnant just absolutely horrible.
I always also have clients that will say to me, I'm just in their first trimester, they just eat bad. They're like, I never eat carbs and I'm just eating hot chips. Yeah. And they just crave, or the carb load, that feels like almost like they carb lots in the first trimester. And that's probably because they're feeling unwell and they need that heaviness in their belly, and that's when they become constipated.
So carbohydrates are good, small frequent carbohydrate meals. In fact, I remember this woman coming to see me. She was a rep, and so she wasn't coming to see me for pregnancy. But she came and I'd seen her for many, many times, and she had in her bag a packet of Smith's crisps. And I said, "You're pregnant, aren't you?" She said, "How'd you know?" I said, "You would normally not eat chips. And you've got potato chips or crisps in your bag. You're pregnant." She said, "Really? Is that how you know?" I said, "Of course, because you're feeling sick."
Because you just eat. They do. And everyone says, I got to stop because this is not good for me and the baby. Yeah. But you honour what you need, right, at that stage.
Absolutely, honour what you need. I remember I was a resort doctor in Fiji. Yeah. And obviously, because
I think you got to write a book.
Got to write a book, memoir already.
Yes.
I'm only 35. Anyway, so there was this kid on this island. Actually, the island basically was a 5-star luxury resort. In fact, Pink stayed there at one time. And
how you know that? I don't know.
Well, the Pink stayed there. Yeah. Oh, because the staff told me. But anyway, so there was 12 bourrées, I think. And so the most you had was 24 adult guests.
Okay.
But in addition to that, there was all these. There was for every guest there was 5 staff, so there was a lot of staff. Anyway, this one time, this couple came and they brought their sort of 10-year-old kid. He was the only kid allowed on the island, and the reason why is because they were the marketing people for this particular island resort. And all the Fijians talked and said that they said the kid only eats chips. They called him Mr. Potato Chips.
Mr. Potato Chips.
The kid. And so anyway, the mum knew this, and she said, "Yeah, he loved chips even when he was inside my belly."
See, it happens.
Absolutely. So no, that's not true. You can eat pickles and stuff like that. Your kid's not going to love pickles.
No. So this about cravings. Is it a thing?
Absolutely, it's a thing. And about your body is going to crave what it wants to do. We know that there's actually a condition called pica. Yes. Where women who have very low iron levels will eat dirt, will eat stuff that's really
dirt and chalk.
Yeah, really weird stuff, because their bodies, and we know animals do that as well. So there's a lot of stuff that you'll eat.
They actually just go and eat it.
They eat it. I mean, it's when they're really deficient, but they do eat that sort of stuff. So we do know that the cravings are real, and Vegemite with sugar or something.
Is it a wives' tale that if you're craving salty versus sweet, I'm sure you hear this all the time about you're having a boy, you're having a girl?
No, there's nothing like that. I know there's a lot of our Greek patients who come and see me, and apparently if the heart rate's more than 140 on ultrasound scan, it's going to be a girl. So they're celebrating. They're going to call the girl Thea or something Greek, Dora or Zoe. And then the next week it's 130, so it's below 140. So now it's a boy and it's going to be called
it's
Yanni.
Yeah, Yanni.
Like every other Greek boy. How many Johns have you got in your family?
Yeah, it's interesting of how people like the cravings and how the people then just want vitamin C. Like you hear a lot of vitamin C, or they just drink fresh milk and they've never done it ever.
Yeah, and I think you just got to listen to your body and that sort of instead of that perspective. Then I suppose the next thing, in terms of first trimester, we've covered off a bit of that. And there's a period of time, I reckon, from around 13 weeks to 21 to 25 weeks where you've got this food, looks like a food belly.
Yes.
But you're not actually, you don't feel, you may feel pregnant, maybe maybe you're still a little bit tired, maybe a little bit nauseated, but maybe that completely goes.
Yes.
And then there's the period where you don't feel any kicks. You just feel like you're putting on weight. And it's a bit of a no man's land when it comes to pregnancy.
Yeah, and women get this anxious because then there's a period of when they're not seeing anyone.
Correct. So there's a big period. And I mean, I always say to my patients or the women I care for that if you're ever worried about stuff, just come in and have a chat. But so then, then you get that wonderment, the joy, isn't it, of when you finally feel the baby move for the first time.
The first time you feel it, like, is that gas? What is that?
Correct.
We don't know what that is actually feeling. Yeah. And then even the second time or the third time, you'll know, you'll feel a little bit because you're tuned with what's happening. But I've got to ask you a question. When people come and see you and you do your first scan, say at 13 weeks, and you're explaining an ultrasound, what do you look at?
So, of course, one of the first ultrasound scans we'll do is a dating scan at 6 weeks. Now, at that point in time, we're looking for a sac within the uterus, and we're also looking for something called a yolk sac, which is like a little white circle. The yolk sac is what supports the pregnancy until the placenta kicks in.
Yep.
And then you'll see something called a CRL, or a crown rump length. So from the crown being the crown of a head, to the rump, which is your butt. We look at that length, and that, generally speaking, will be consistent irrespective of whether you're going to be a big baby or a little baby from the very start. So it gives us a good, accurate measurement of growth. Of gestation. So we know that a certain size will match a certain gestation. So we can accurately diagnose the pregnancy. That's the first thing we look at. As the pregnancy advances, and particularly after 13 weeks, once we get into 21, 25, 30, 29, 32 weeks, we're looking at the growth of the baby. And the sentinel things that we look out for are the tummy size initially.
Yeah.
The tummy size is the most sensitive measurement in terms of the health and well-being of a baby. Yeah. And this is partly because the babies will put glycogen as a form of energy in the liver. And, the bigger the liver, the bigger the belly size, the happier and healthier the baby is. It's a bit like Hansel and Gretel. If you remember the story of Hansel and Gretel, Hansel was getting fed by the wicked witch, or whatever her name was, who was going to eat him. And but he put out that little bone, so she didn't. She thought his finger was still bone.
Did your kids love story time
with me?
Yeah, because you were like,
you know what? I read Isla a sleep story last night about Elsa and Anna, and I was almost falling asleep myself. But I have to put the magical words.
Yeah, that's what I was like.
Yeah,
Yes.
In Arendelle. They went to the summer house. All this sort of stuff.
Is this what you do when you do your ultrasounds?
You know what? Sometimes she says to me, Isla goes, Dad, don't put on a voice, Daddy. I love putting on the voices, So
Daddy stays awake.
Yeah. I'm like sitting there going, all right. Anyway, but so I've completely lost what I was saying. But yeah, so we're looking at the tummy size because the baby's putting on a lot of weight. So just like Hansel, he would have got nice and fat and plump. So does the baby. If the baby is growth restricted, so in other words, the placenta's not working, the baby's not growing, then the first thing that will happen is the tummy size will not grow. And part of the reason for that is the placenta does everything that's inside the belly. It's the stomach, it's the liver, it's the waste disposal unit. It's also the kidneys, it filters blood. And so the baby then will sacrifice the tummy because the placenta's doing the vast majority of the thing. The most important thing, though, for the baby is its brain. So it'll preferentially send blood to the brain. And so the brain size or the head circumference, so this is putting a tape measure around the baby's head, will be protected at the expense of the belly. So if you said to me, Joe, at any point in pregnancy, what would be the thing that you would always want to measure? It would be the tummy size, because I want to make sure the tummy size is consistent with the gestation or the number of weeks that you're pregnant. So we look at the tummy size, but of course, every single time we'll also look at the head circumference. So tape measure around the baby's head. We'll look at the size from temple bone to temple bone of the baby's head, and we'll also look at the femur length. And if we put all those measurements together, we get a rough estimate of the baby's weight. Yep. Also, we look at the placental location. So early on in your pregnancy, you may feel movements a lot sooner or later, depending on where the placenta is positioned. So if you imagine the uterus as like an Aussie rules football, or if you're listening to this up in our northern states, a rugby ball, even though I don't understand rugby, I don't know why you don't follow AFL. But if you imagine under the laces, you put a pillow and put a baby inside the footy. If the baby's punching the pillow, if you put your hand where the laces are, you're not going to feel the movement. So if the placenta's sitting in front of baby, you won't feel the movements as soon as a woman where the placenta is sitting at the back. So if the placenta is now sitting in the back or the back of the footy and the baby's able to punch directly under the laces, then you're going to feel the movements a lot sooner. So often when we'll say, my friend felt movements at 19 weeks and I'm still 21 and I'm not feeling them, absolutely normal, depending on the position of that placenta. Then later on in pregnancy, we always, always, always encourage you to keep an eye on the pattern of the movements of the baby. And if there's a change in the pattern of the movements, to let us know, because it can be a sign that the baby might be distressed and we need to be sure that the baby's okay. So, but, in those first few months of, up until 21 weeks, don't be overly surprised if you're feeling movements later than someone else.
And this is somewhere that I can come from when we talk about free birthing, where we not worry, but when we talk about having no scans, right?
Yeah.
So, and understanding that they have never had a scan throughout their pregnancy until, they don't at all because of worried of intervention.
It's interesting, isn't it? I think people who free birth, and this is not, and again, I'm not driving fear because I think that's the wrong thing to do.
Yeah.
But I would actually say to people who are considering free birthing or not engaging with anyone in the medical system, that think about your life in general. Your life in general, if you're a free birther, is all predicated on the fact that knowledge is power, right?
Yeah.
Everything that I'm sure, if you think about what you do I want to know about this because that's going to give me the knowledge to do what I need to do in my life. Knowledge is power. And the fact that you may choose to disengage from even the minusest amount of medical not examination might be, or ultrasound scan, limits your knowledge in terms of your birth. Because if you're able to see the baby, see the growth of the baby, that gives you confidence that you can do the birth experience that you want. If you know the position of the baby's head down, it gives you the confidence that everything's going to go okay. If it's breech, you still may want to choose to have a vaginal birth. I'm not saying don't, but it allows you to forecast and prepare in the event that something potentially might be an issue. So I really implore people that are considering doing less things. I don't want to do a sugar test. I don't want to do this. I don't want to do that. I'm not saying you choose you. That's my philosophy. You choose you. It's an informed decision process. But part of the thing that I want to say to you is if you come from the premise that knowledge is power and you want to know stuff, then that knowledge can give you the confidence to do what you want to do freely. And I think that's really important to understand, that a lot of the investigations that we offer, a lot of the things that we do is predicated on giving people options, positions, and also the empowerment to do what they want to do. And for example, it starts very early in pregnancy when we talk about potentially screening for Down syndrome. Now, as a human, and I know that when my wife and I discuss this, and I'm sure she won't mind me saying that I would find it very difficult to medically interrupt a pregnancy based on a baby having Down syndrome. However, it is not my right, nor is it my choice to force that upon my patients. So have I electively helped a couple medically interrupt a pregnancy for Down syndrome? I have. Couldn't do it personally, but I'm not happy. I support their decision that they're making. So I always say to couples, particularly if you're doing Down syndrome screening test, you do the test number one.
Yeah.
Number one, if it's going to better prepare you for having a child with additional needs, or alternatively, you're going to act on the result to medically interrupt the pregnancy. Now, some people might find medically interrupting the pregnancy abhorrent, but it's not our choice. That's not our choice. One of the great things about living in Australia as opposed to America, where things are getting quashed when it comes to abortion or medical termination, is the fact that women have a reproductive choice that they can make. And we as medical practitioners are there to help them and guide them make that choice. So I think, part of everything that we do from very early on, when we do all our investigations, such as even the simple thing like vitamin D testing, or alternatively a urine test for infection, it's all about providing choice in terms of empowering our patients, our women, our birthing mothers, birthing people, to make an informed decision about bettering their health care through pregnancy and childbirth.
They also have this fear of that, because if they get a result they don't want to hear, it's going to change their outcome for birth, right?
I think diabetes is a clear one with that.
Yeah.
Where they fear that, of course, now they've got diabetes, that they're not going to be able to have a vaginal birth, which is not true.
Yeah.
It means that we can manage the sugars. We can make sure that the baby's not exposed to a high sugar load. And one of the other things that we know about diabetes in pregnancy is that we know about genes, for example.
Yes.
So genes can be switched on and off. It's a bit like having an electrical wire going to a light. That's the gene. Switching on the light is actually a switch. Now, you can turn on and off the light by using the switch, and in the same manner, you can turn on and off a gene by these things called epigenetics. They're the switch. And we know that babies that are in utero, so in the uterus where they're exposed to high amounts of sugar, can actually have a predisposition to things like diabetes and cardiovascular disease later on in life. So part of what we do in pregnancy in order to control the sugars isn't just so that we can have a happy, healthy baby in the short term, but it's also about making sure your child, when they're an adult, has the best life that they can possibly have as well. So it's not just about the pregnancy. It's so much more than just about the pregnancy.
I think that's the missing piece.
Absolutely.
They just don't know that there is more about it.
Absolutely.
And they're very quick to put something on social media of what this is and why you shouldn't be doing it, to not actually understand exactly those points on why you're doing it, not just because it's a test.
And also the other thing to make mention is it's no reflection on you whether you've got diabetes or not, right?
No.
Diabetes during pregnancy. The placenta produces hormones that antagonise, or other words, block the action of insulin, and therefore increase the sugars throughout pregnancy. And so managing that is not a reflection of your poor diet. It's not a reflection on how well you're going to be as a mum or how well you're doing in pregnancy. It's more simply about being able to support you, giving you an informed decision process and helping you have a good experience. And we also, the other reason why we want to help with the sugars is when the baby's born, if you've got a baby that's got a huge amount of sugar load during pregnancy, if it's born, or when the baby's born rather, it's expecting more sugar. So its insulin levels are really high. And if it's born and it's not getting the same sugar that it used to get during its time in the womb, the sugars can drop and the baby can become unwell. So it's about understanding that we need to know that so that we can help the baby later on in life.
Yeah. I think too, it's just, even when people say, I've got diabetes, and they'll call me and I'm like, yeah, cool.
That's right. It
doesn't change.
Shouldn't be anything to worry about, is it?
It doesn't change anything.
We focused a lot on diabetes. Let's move on a little bit because.
We're talking about, obviously, I want to ask about things about kicks and things about when you're wanting to contact you, and certain things about. I know you mentioned it briefly, very quickly, but about the kicks towards the end of pregnancy, and understand the difference between a kick and a jab. That whole movement.
So, look, I think the first thing I always say to couples and women and people who are pregnant when they come and see me for their first pregnancy visit is that there is no question that's too trivial and no problem that's too small. I say that at the end of every consult. And that's partly because and this is true if you've had a baby before. If you've had a baby before, a lot of women sort of sit back and go, I shouldn't really bother Joe because I should know better. I've done this before. That's
Yeah.
not the way to feel. I mean, we are here, particularly if you're choosing private obstetric care. We as obstetricians are here standing ready. Remember, the obstetrician
Yes.
means to stand. To stand there waiting to help and assist you at any point in time you need me. I mean, I am on call literally 24/7 for the very same reason. I remember there was one woman that called me. It was about 2:30 in the morning, and she called me and I answered the phone. I said, "G'day." It was about 2:30, so I'm a bit tired. It's Dr. Joe. How are you? And she goes, "Good, Dr. Joe." I said, "Oh, that's great. Tell me what's happening." She said, "Dr. Joe, I'm in Bali." And I said, "Oh, that's fantastic. What's going on?" She said, No. I just wanted to tell you I'm in Bali. I forgot to tell you, and I just thought I'd better let you know just in case there was anything I needed to do." And I said, "No, that's okay. You're okay." Although I will say that was before the whole thing about Zika. So if you're thinking about going to Bali, please check the Smart Traveller. In fact, if you're planning to travel in pregnancy, check the Smart Traveller website. Smart Traveller has a really good detailed pregnancy section about things to be concerned about if you're pregnant. There are certain places in the world that I would recommend you don't go during pregnancy, and Bali may be one of them. But anyway, that's just a segue to say that I'm on call 24/7 but no trivial problems. However, maybe not to let me know that you're in Bali.
We have obviously pregnancy changes our bodies as we develop, and things like swelling.
Yes. Very common symptom. And a lot of people get worried about swelling because they think that it's related to high blood pressure, which of course it can be.
Yeah.
But swelling is a very common pregnancy symptom. So we don't necessarily go, "Oh, you're swelling, you must have preeclampsia." Preeclampsia, which is high blood pressure in pregnancy, really is the fact that you must have high blood pressure.
I remember being pregnant and I was like, I'm going to get stretch marks on my ankles. That's how bad they were. Like, how did I even?
Well, you get cankles, don't you?
You do get cankles, and then the poor women, they come like, "I can't wear any shoes. These are the only shoes that fit me."
Yeah.
They can't. But then it also can happen post-delivery.
Absolutely can happen post-delivery.
Where you think that baby's out, it's just going to go.
No, it takes a while, but swelling is definitely very common, particularly latter part of pregnancy, and of course all the muscle aches and pains that we talked in our previous episode with our physios. Women will get pelvic instability.
Yeah.
So the pelvis you think about as sort of a very rigid structure. If you imagine your two bits of your hands coming together and your fingers lining up and your thumbs lining up, if you put them if you're on YouTube, you can see it. But your pelvis is quite a fixed structure. So when you move outside of pregnancy, it sort of moves nice and solidly. Yes. But if you imagine you just separate your fingers and your hands a little bit and you sort of jiggle your hands from side to side, you can imagine now that if that occurs, that's going to cause a bit of pain. So during pregnancy, the pelvic bones actually separate about 2 to 3 millimeters, and that's to facilitate birthing process. So there's a lot of hormones, relaxin being one of them, that relaxes the ligaments that support the pelvis, and that causes a malalignment in terms of all your muscles, and that's why women get a lot of pain during the latter part, absolutely, between the latter part of pregnancy. So heading into that latter part of pregnancy, there's a lot of deep pain, feeling like there's a lot of pressure. These are very common pregnancy symptoms. Lower back pain, particularly important as well.
And heartburn.
Heartburn's the relaxing the muscle that attaches from the stomach to the gullet or the esophagus, and you get a lot of reflux symptoms.
Or the wives' tale that the baby's going to come out with a full head of hair.
Correct, and sometimes obviously the baby doesn't come out with a full head of hair.
No, it doesn't happen. But that is all the wives' tales of why and how you carry.
Absolutely.
True, like if you carry more to the front, you're having a boy. If you carry wide, you're having a girl. They take away your beauty. It's so interesting.
Taking away the beauty. That's what the wogs say, don't they?
They do. They say, "Oh, you're having a girl because she's stripped all your beauty
away." That's what I try to say to the patients to make them feel better. Sometimes it's not a good thing, but it is true. I mean, there's a lot of old wives' tales, some of which, of course, are rooted in some beliefs. But it's interesting. I obviously, my Instagram feed is fed with a lot of Sicilian and Italian myths. But in Italy, for example, you can't go for for a swim until you've after eating for at least 2 to 3 hours because it's going to cause indigestion.
Oh, yeah.
Or you can't go out the house with wet hair because you're going to catch a cold.
I wonder how us Europeans have actually survived without fear. Like, do you know what I mean? Like, you couldn't do a lot of things because of,
but the other
don't
thing,
walk under this,
but the other
don't
thing
do this.
The other thing that I think's happened, I mean,
I love that you can't make sauce when you're on your cycle because then the sauce will turn bad. I think the women were just like, I'm using this as an excuse.
Give me a break.
Yeah.
I think there's, you know what, one of the things I find, and I know we're not talking about, we could probably do a whole podcast series just about growing up as Italians.
Yes.
But I mean, I don't really consider myself as an Italian. I grew up in a green leafy suburb of Melbourne that had no Italian mates. But one of the things that I think, this is just a segue, one of the things that I think has happened, unfortunately, to probably Italians and Greeks and maybe some other ethnic groups within Australia, is that they came across in the 1950s and 60s thinking that was Italy or that was Greece or that was Spain or whatever. And they brought all these morals and values to Australia and they haven't changed.
Yeah.
And Australia has developed and their children have grown up in an Aussie culture.
Yeah.
And yet they hold on to these values that are still rooted in the 1950s. And I remember, my wife and I got married in Fiji and we upset a lot of our relatives because we just got married over there and didn't have the big wog church wedding. But, cousins in Italy are eloping.
Yeah.
So the world's changed.
It's totally changed. We're just sort of stuck. And I know that we have things that my mum will say to me, you don't do that anymore. But we try to keep
the traditions.
The tradition.
Hey, tell me any natural remedies or practical comfort strategies women should consider in the latter part of pregnancy. Libra comes in a range of pads from a liner with double 2-in-1, invisible, ultra thin, maternity, and extra protect.
My number one tip for your hospital bag is Libra maternity pads. One of the biggest techniques that I like to use, especially for my clients, especially just before labour, a lot of anxieties will start to play of either how they've conceived and certain things that I get them to journal quite a lot because they can't find that they can sleep because their mind is going, and it may not even be pregnancy related. It might be that they're having their second and they're leaving their first home. So they have this anxiety of like, will I love another child? So there's lots of stuff that I work with them in the sense of journaling. It's one way. And then I'll say to them, what comes up for you? So then we re-talk about it. If it is labour, then I'll reflect back to you and I'll say, well, next time you see Joe, ask these questions. Or they didn't think this would bother me or certain things. So journaling is one. I make them do a date night.
A date night?
It's huge. So one of the homework is to have, because they're so focused of getting the nursery ready, doing everything, they forget about each other.
No, I agree. I think that's one of the biggest things that you couples should do is concentrate on themselves because, once the baby's born, and actually it's true, I think for any partner, whether you're male and female of a person who's going through pregnancy and childbirth, is that all of a sudden this person was yours, every part of their body was yours, and all of a sudden there's this other person that comes into the world and they take over precedence, and your partner's breastfeeding and they're exhausted and whatever, and then you subsequently feel disengaged in the whole process. I think the other thing that you picked up on was love. It's really interesting that someone would feel that they won't potentially not love another child or won't love them as much.
Yeah.
And one of the things that I think, a couple of things I say to patients is hug your firstborn. If this is your second baby, hug your firstborn because they're not going to be a baby anymore.
No.
The other thing is that baby that's now a toddler or whatever, they have spent, whether it be 6 months, 9 months, 12 months, solely with you. This newborn that's coming into your world is only going to get, if you're in the private sector, 4 or 5 days by themselves with you. If you're in the public sector, you're out the door the next day, right?
Yeah.
But at best,
because they
5
want to rush
days.
to go home.
They want to rush to go home. And can I tell you, if you think back to yourself when you were 1, 2, or 3, you probably can't remember at all
No.
what happens. So spend the time with the newborn.
Oh,
That is most valuable. And I'm not saying don't completely disengage and dissociate yourself from your other kid, but just realize that this is a wonderful time to love and nurture that newborn time that you got with the firstborn and that you'll never get again if you rush back home with the second one.
I remember that with having the second with my second Adrian, and I was worried Lucy was just not going to cope.
Yeah.
She had the best time at her auntie's.
Yes.
She was like, Mum, who's Mum? Like,
exactly.
They don't, it's us.
Yeah, the guilt, it's the mum guilt.
It is the mum guilt. And she was like, yeah, cool, Mum. And she came and saw her sister. And then obviously lockdown happened. So then towards the end she couldn't. But it was just, she was fine.
Absolutely.
It's all what we are having this in our head. But it's one thing that I do make my clients is date night and to be able to reconnect. Because if they've been on a massive fertility journey, a lot of it in parts is lost.
Yeah. One other anecdote that I'm going to share is, my daughter Kiara, my wife and I decided we'd go back after several years to have another kid. And so Kiara at the time was sort of 13.
Yeah.
And I remember she said, Dad, you're not going to love me as much when we have another baby. And I said to her, of course I'm going to love you. And I said, not only that, there's going to be more love in the world. You're going to have a little baby that you're going to love. Yes. They're going to love you unconditionally. And there's just more. There's more love. And when Kiara, it's one of those I told you so moments with your children, which is always good when you're a parent and you've got an I told you so moment.
Yeah.
But when Isla was born, and I said to Kiara, do you feel the love? And she said, I do. I said, so much love. I love her so much, Dad.
And it's the same thing. They don't realise what actually then comes.
Absolutely. So even for kids, I think, they will appreciate, they know that there's something that's changed, but it is for the better.
Yeah. So I do that. So I say to them, you don't have to go to like all the fancy, even if it's just getting your favourite takeout and just being together. It's just having something to stop. Because as I said, there's some partner or, their support, they're like working right to the end. They're just stopping. The other thing is that I always get them to do some acupuncture prior to the end, getting their bodies ready. And if it gives them an hour to stop or get them to do something for themselves, is important, because I think we just keep going and then they'll go, I'm on mat leave, I'll do this on mat leave. But sometimes people don't even make it to their mat leave, right?
Correct. And I do think you need to take a bit of time for yourself as you're heading into birth, and whether that be the first time as a mum, just making sure that you're taking time to yourself before you have a baby, but also if you've got a baby already and just spending time with them, because yes, the focus is going to be less on them, quite obviously, and just making sure that you feel that child knows that they're well loved and supported leading into birth and to birth and the postpartum period is going to be particularly important. But
we do lots. All my sessions are broken up. Obviously, when I see my clients, the first one is talking about birth itself. Yeah. All the stigma or when I mention birth to them, what does that even come? Yeah. What comes to their mind? And so I'll say, have you started to talk about it? And they'll be like, yes, have you discussed it together? Because even though that she may have thought about it, have they discussed it together?
And I think that's important, isn't it? Particularly for a partner. Again, it's not about you, this whole birthing process, but it is. How are you going to support your partner? What does your partner want you to do? Yeah. And it's not unless you have that open discussion about, do you want me to massage you? Do you want me to offer you water? Do you want a face washer on you? What do you want me to say when you're pushing? Do you want me to encourage you? Do you not want me to encourage you? Have you got a word that you want to tell me that tells me to F off quietly? Yeah. All these sort of things are particularly important, because it is as much as it is the birth experience for the person that's birthing, it also is an experience for the partner as well. And also you got to remember, particularly for males, this is a brand new area that they've been in. I mean, it's only really been the last 40 or 50 years that guys have even been invited into this space.
That's right. And I always ask the partner, or I'll say to them, what do you see as an empowered birth or a positive birth? Yeah. And I ask that question to them before I ask the birthing mother, because they will say, I just want it to be safe, health. Like there's a different element.
Blokes are different, yeah. Or particularly blokes might be different, yeah.
Different. But they want safety. There's always a big element
they
of
want
safety.
the baby happy and safely born. And I think that's partly actually the issue when it comes to the whole birthing experience, is to remember that this is one day of your life. It is an important day of your life, but it's not the be-all and end-all of your life. And really, at the end of the day, whilst we want your birthing experience to be as empowering and the best experience it can be, we also want it to be the safest.
That's right. So
we'll end on that note. That was a lovely episode. I'm sure we're going to talk a lot more about particularly birth and also pregnancy with a few guests and the like. But look, thanks for listening, everyone.
Thank you.
Doula and the Doc, hosted by Vanessa Salerno at birth.
Can we just put in the bloopers at the end?